Hello and welcome. We are delighted to have this conversation today to talk about an exciting project focusing on equity-centered transportation policy with the Center for Black Health and Equity and the Office of Minority Health. I am Mary Williams Stover, Equity-Centered Policy Manager with the Center for Black Health and Equity. And the project that we are going to discuss today is made possible with funding from the Office of Minority Health. We also want you to understand the mission and the purpose of the Center for Black Health and Equity. And our mission is to facilitate public health programs and services that benefit communities and people of African descent. We do that by supporting and building community capacity and developing community infrastructure, as well as advocating for equity-centered policies. And we'll be talking more about an example of an equity-centered policy and its impact on communities. We are committed to addressing the social and economic injustices and emphasizing and making individuals and communities aware of solutions to impact structural racism across the country, as well as to address deep health disparities. I am really excited to talk with our project team today and to introduce you to our project team. And before we talk about the specific individuals who served on the team, I want to kick off by introducing one of our key principal participants who will help to set the stage for today's discussion. Dr. Daniel Dawes is a public health expert, author of The Political Determinants of Health, and leader of the Meharry School of Global Health. Also serving on the project team is Nelson Dunlap, JD, Vice President for Public Policy and External Affairs in the School of Global Health at Meharry Medical College. Manire Vaughn, JD, also serves on the team. He is founder and principal consultant with M93 Consulting Group. And he is joined also by Tonya Cureton Curry, JD, and senior staff attorney with the Public Health Law Center. Dr. Helen Holton, founder, CEO, Chief Engagement Officer of Dr. Helen Holton and Associates, is rounding out the team, as well as Ms. Princess Wilson, who is a project consultant on the team and legacy resident of Sweet Auburn neighborhood in Atlanta, Georgia. Welcome, everyone. So delighted to have you here with us today. If you would help to set the stage for this conversation and the 3-year research project, as well as community engagement project implemented by the Center for Black Health and Equity. Give us an overview and your perspective on equity-centered policy and what it means so that we all understand, all of our viewers understand what we're talking about today and why it matters.
Well, thank you so much, Mary, for the kind introduction. And of course, a special thank you to the Center for Black Health and Equity for spearheading this groundbreaking policy project. I also want to thank my distinguished colleagues who have spearheaded this project, who have been trailblazers in this movement of health equity. You know, for too long, African Americans, lower socioeconomic individuals, people with disabilities, and other marginalized groups have found themselves in a precarious situation. Their health, their lives have literally been hanging in the balance. Many of them falling through the cracks of our health system, educational system, human services system, housing, behavioral health, employment, you name it. In our country, our community's health is not an organic outcome. It is not a coincidence that certain groups in our communities have experienced higher premature death rates than others. Our systems have not always valued each group equally or realized the long-term implications that policies have on the health of its people. We've seen how the hierarchy of human value has evolved over time in America, and how inequities in our society were structured or concretized in our policies over hundreds of years. Let's be real clear. Health inequities are the unfair and avoidable differences in health status that arise from the social conditions in which all of us are born into. We grow in, we live in, we work in, worship, and age in. This is caused by no fault of their own. These differences are not merely about genetics or individual choices. They are, in fact, deeply rooted in social structures and policies. Recently, the world-renowned economist Thomas Piketty concluded, inequality did not simply emerge from economic reality, from technological change or the organization of production, nor from inherent disparities in individual talent, ability, or effort. Rather, he argues, inequality is determined through struggles that take place in the political sphere. Think about that for a moment. Inequality is determined through struggles that take place in the political sphere. In my work and in our work as a group on the political determinants of health, there is a recognition and an understanding that policy is a driving force for many of the health inequities we have observed or even experienced ourselves. And only policy can fix what policy essentially broke in the first place. Fundamental to this work is the core understanding that these differences can be reduced or even eliminated by taking proper actions or making the right investments. You see, throughout our history, you can see the struggle, the constant struggle, a tug of war, if you will, between those advancing the political determinants of health inequities and those who have been trying to counter the negative effects of policies by leveraging the political determinants of health. From 1641, when the Body of Liberties law was developed that essentially legalized slavery in this country and was then eventually amended to include the descendants of Black enslaved people, to the development, the passage, the implementation, and enforcement of policies prohibiting Black and Indigenous groups from raising their own food, earning their own money, learning to read and write, or moving beyond a certain mile radius. We can see how laws and policies were used as tools to deny certain population groups the ability to reach their full health potential. As we moved away from explicitly racist policies, denying the benefits of social and economic policies to African Americans, to facially neutral policies, as we call them in the law, such as the Homeowners Loan Corporation Act, the Housing Act that created the Urban Renewal Program, and the Highway Act, which created our 41,000-mile interstate highway, we continue to see the harmful effects of policies that were intentionally or unintentionally designed to exclude certain groups. Today, research has shown us that over 500,000 African Americans were displaced as a result of the Housing Act. African American children today have the highest death rates from asthma owing to the Highway Act, as well as disproportionately higher rates of diabetes, cardiovascular disease, and cancer that have been tied to these infrastructure, this Highway Act. Political determinants of health are evidenced in the data. Research has shown that high obesity rates, maternal mortality, infant mortality, gun violence, depression, anxiety, opioid addiction, substance use disorder, HIV/AIDS, diabetes, and many other health problems can be firmly linked back to policy action or inaction. Today, research also confirms why we need to engage in this project and why equity-focused policy solutions are needed. Research has shown that downstream interventions, which focus on change at the individual level, are more likely to increase health inequality than our upstream interventions, which focus on social change, or in this case, policy change. And according to the National Academies of Science, Engineering, and Medicine, they state that mortality is affected by factors operating at the macrostructural level, those state and federal policies, and of course, corporate policies, or as well as the meso level policies, right? Our workplaces that we work in, and the individual proximal level, the health behaviors and socioeconomic circumstances that people find themselves in. According to the National Academies of Sciences, Engineering, and Medicine, the macro structural level exerts a strong influence on the other levels. For instance, state policies affect individuals' access to affordable health insurance. State policies can influence health behaviors through tobacco excise taxes, marijuana legalization, alcohol pricing, opioid prescribing regulations, and much more. And state policies, as well as federal policies, can influence individuals' socioeconomic circumstances through education expenditures, minimum wage levels, housing policy, taxes, and much more. You see, when the current health inequity challenges are viewed through a political determinant of health lens, tangible and meaningful steps within the scope of human control emerge. Actions that can be taken to better, more equitably, and of course, justly protect and preserve the health and well-being of everyone.
Thank you, Daniel. You've given us a lot of perspective, a lot to think about, and you really set the stage for an interesting conversation. Now we are going to delve more into this project. The goal of the project, of course, to empower communities to voice their concerns, advocate for change, work towards creating more equitable transportation systems. You've told us about the impact of federal policy, specifically the Transportation and Highway Act. And so we want viewers to learn more about the research approach and benefits of balancing research and qualitative input and fact finding. And so let's talk about the project and the process. Nelson, would you speak to the prevalence of inequitable transportation policy and why examining its impact on Black and Brown communities is critical?
Yep, that's a great question, Mary. And when I think about that question and how complex and how deep it is, I'm not scared by it because I think that the response is actually pretty simple. And I think that the work that we've done will illuminate that. I think that an oversimplification of really how we got here is kind of the concept of point A to point B, right? We all know that we in this country, we have to rely on transportation to get us from point A to point B. And it doesn't actually matter what point A is or what point B is. I think we also know that more often than not, the transportation between points A and points B frequently has to deal with our highway systems. So if point A is a community of Black and Brown bodies, and point B is a brighter tomorrow, no matter what tomorrow even entails, if that's jobs, education, healthcare, you name it, then the transportation between those points has to be reliable, it has to be safe, and most importantly, it has to be equitable. Well, spoiler alert, that has not always been the case in our country. So when you look back over the history of America, you see similar versions of the same story over and over and over again, right? That story being how life was in the given community before the highway got there and how it was after it got there. And frequently, those communities look like you and I. They are communities of Black and Brown folks. We also know that highways have been systematically and systemically used to carve up or divide our communities, leaving those communities decimated and downtrodden, but most importantly, not voiceless. I mean, you can take Atlanta, for example. There's a neighborhood in Atlanta, the Sweet Auburn neighborhood, that consists of six interstate highways, all constructed in the 60s and 70s, right around the same time as the Highway Act of 1956. And the highways there, they run right through truly historic Black communities. That didn't happen by chance. That wasn't just, throwing a dart at the map. That happened by decision. So if we know that transportation is key to getting us from point A of our communities to point B of a better and brighter tomorrow, but we also know that transportation has been used, historically to send us not to point B, but to point S for segregated or split up, then how do we right these wrongs, right? A few years ago, President Biden had the opportunity to sign into law the Infrastructure Investment and Jobs Act. And that presented us as a society and as a country with the first chance in generations to put federal dollars towards actually improving our transportation infrastructure, to finally put our money where our mouth is. But most importantly, to do it in an equitable manner. But that's only going to happen if we can provide the data, the tools, and the plan to the folks who need it to hear it the most about how to actually do this in an equitable manner and to right those wrongs of yesterday. So that's how we got here today, right? We as a group, we as the Center for Black Health and Equity, we're looking at the historical transportation policies of yesterday to make sure that they aren't implemented tomorrow. If we're ever going to actually reach point B, and point B being a better and brighter tomorrow, we have to make sure that today we do it in a way that's cognizant of what we've been through, that's careful, and that's attentive to the needs of our community, and in a way that prepares us to all feel empowered to move forward. Hopefully that responds to your question, but I'm looking forward to the rest of the conversation where we'll continue to really kind of dive in and talk about what we've seen thus far. But to answer it in a short answer, history doesn't repeat itself by chance, it repeats itself by decision. And we want to make sure that we are stepping in there to make sure that everyone has the opportunity to ensure that tomorrow is equitable.
Thank you. Thank you. Absolutely answers the question. And now it makes me more curious. Manire, how did the team approach this meaningful work? And what are some of the expected or shocking revelations?
Thank you, Mary. Yeah, so the one thing to just keep in mind is that our team's approach was a bit ambitious. And during our projects, two things were happening simultaneously, right? So the first piece was we were using a legal epi framework in order to assess transportation laws, policies, and plans, all enacted after 1956. And we did this for 5 different jurisdictions. The second piece of our project was engaging with community about the fruits of these laws, policies, and plans, right? Now, many of us on this call are attorneys, but we know that municipal code and Westlaw can only take us so far. And very early on, the team recognized that we needed to engage with the community in order to truly understand the impact of these laws, policies, and plans. The one thing that I think was probably the most shocking is that jurisdictions across the country still do not prioritize public health when they're considering various highway projects. So this is pretty shocking because, as Daniel indicated, really since the creation of the interstate highway system, there has been copious amounts of research done to really understand the impact and specifically the health impact of these highways, right? So Daniel touched on asthma, but let's go there for a minute, right? If we think about asthma, we know that research tells us that vehicles emit something called particulate matter. Particulate matter is a bad thing because usually particulate matter can be tied to respiratory illnesses, including asthma. Treating asthma is incredibly expensive. Not only is it expensive, but we know that children who have asthma often miss key instruction time due to them being out of school, right? And for the purpose of this conversation, we also know that Black and Brown folks are disproportionately diagnosed with asthma compared to white Americans, right? So you think that the urban planners, the transportation officials would account for the proximity to hospitals, the proximity to clinics, the cost of medication when they're thinking about highway projects. But simply this is not the case. And at the very least, when we talk about health equity, and we'll talk more about it throughout our conversation, we have to not just think about public health, but specifically health equity. And what does that mean for people who have been historically disproportionately impacted by these highways? And also, what does that mean in policy, right? How can we codify some of the terrible decisions that have happened in the past through effective policymaking, through effective decision-making? And the way that this team approached it was, we do it by going into the community.
Can you talk more about legal epi and give us a quick explanation of what legal epidemiology is and how it was used for this project?
Yeah, so legal epidemiology, it really does apply a very rigorous scientific methods to translate complex legal language into data that can actually be used to evaluate how laws affect population's health, right? So in simple words, essentially you're looking at these laws and policies and really seeing how they impact the population. And that is specifically what we did here, right? So we didn't just stop though at looking at these laws. We also asked the people, right? So in addition to how we're seeing how this law works, we're also wanting to chat with folks and figure out how they experienced it. To this end, within our project, we did the collection, the coding, and also analyzing of these different laws and transportation plans and policies. But like I said, we did it for 5 jurisdictions, right? So this just wasn't one place in America, but we decided to really go throughout the nation on the West Coast, the East Coast, and the South and Midwest as well.
So that's quite an overview. If we talk about 5 different jurisdictions, Manire has told us about legal epi. Tonya, can you speak about the limitations of legal epidemiology and what were some of the challenges the team encountered? And then more specifically, how did you maintain equity-centered lens for this project?
Sure, absolutely. Thank you, Mary, for that great question. And thank you, Manire, for that introduction to legal epidemiology. I think, as you mentioned, as attorneys, we had a little bit different approach to how we might compare and contrast these laws. But the legal epidemiology process, again, as Manire mentioned, includes a very rigorous and detailed quantitative process in which we compared laws and policies from the 5 different jurisdictions. So there were specific questions that we asked, specific policies that we looked at. And in doing that, we realized that there were some limitations in how deep we could actually get, because we felt that there was something more than just the numbers or the comparison of, they did this in this year, or they did this many times, or they had this many particular roads that they were trying to work on. All those things were very quantitative, but the limitation that we found, the biggest one, was the fact that the qualitative data was missing. The opportunity to get that input from the community, the lack of community engagement in that decision-making process as these jurisdictions were developing the policies and the laws and the statutes, we really realized that not only was there a lack of that, but it varied between jurisdictions. So, for example, in one jurisdiction, there might have been a significant amount of deliberate and intentional community engagement. And perhaps that was documented through a government entity that was responsible for gathering that type of information and for making it part of the process. And then you might go to another jurisdiction and find that they had not had that at all over the years since 1956. They maybe had no community engagement, and they were only recently trying to incorporate that. So I would say that was really one of the biggest limitations that we saw. And another limitation was just the fact that while our questions were uniform, you weren't always able to compare apples to apples within across jurisdictions. And so it did not necessarily seem like things were completely comparable, although our questions were all uniform, and we recorded the answers and the responses as it needed to be. So our approach of adding that qualitative data to our research and to this process really, we think, enhanced and made the overall research and the overall outcomes that we established much more meaningful and impactful.
So I'm really interested. Can the panel talk about what 5 cities were selected for the research and why?
Yeah, I think I'll jump in here first. And I'll say that, we picked 5 cities, but what can never be reiterated enough in politics, policy, culture, you name it, is that the Black experience in America is not monolithic. And while that is true, what we have seen is that the playbook that is utilized time and time again is often very similar, right? And so we sought to find cities that would provide geographic diversity kind of across the country to do 2 things. One, to highlight both that the Black experience is not monolithic, but more importantly, to show that not only are the playbooks that are used against our communities very similar, but that the interventions that we are attempting to highlight and implement can be replicated and implemented no matter where you call home, right? So between, St. Paul and Houston and Ohio and Texas and all the places that we will talk through very quickly, the point is that what we've created and the resource that will live on with the Center for Black Health and Equity, it can be used anywhere you go. I think that that's the main thing to keep in mind for the 5 cities. I can jump in very quickly. I mean, we've talked about, Atlanta. I can say that we looked at Cleveland, Ohio as well. Cleveland has the Inner Belt Development Project that was kind of a historical harm, and that impacted the Buckeye, Woodhill community, the whole community, the Kinsman community. And the reason that we picked that is to say, look, there's a very clear example of infrastructure and transportation, more specifically, used as a wedge and a tool that disproportionately impacted communities of Black and Brown descent. Let's look and see if we bring the legal FB framework to bear and we use in community engagement and we create this resource, if we have an opportunity to move the needle on health equity and all of the great things there. That's one example. I'll let any of my other kind of colleagues jump in. But again, the reminder being, we wanted diversity because we don't all look the same, but we all kind of feel the same pain if we don't fight together.
And I can hop in here. So Black communities across the country, there's one recurring story, and that is life before the highway and right after the highway, right? So in wanting to go coast to coast and talk about, just the atrocities that happen to these communities, we really wanted to highlight some things that may be lesser, not as well known. One of those communities being the St. Paul community, right? So we know that the Rondo community was a thriving Black community. However, the construction of I-94 destroyed, tons of families as well as the business and economic advance within those areas, right? Researchers tells us that it's estimated that 600 families lost their homes. Again, another 300 business also were impacted by the construction of I-94, right? Small community in Minnesota, but it's also important to tell their story. I can also chat quickly about Houston. So Houston is an interesting one because there's some current legislation going on there. So really the team wanted to be responsive to what are some of the highway projects that are going on currently, and how are we able to respond to those needs and go to community and actually talk to folks who are experiencing these atrocities now. But really, historically, if we think about Houston, specifically the Friendship Heights area, we know that Independence Heights was the first Black municipality in the state of Texas. We also know that it was home to many Black homeowners at the time, and they were being discouraged from having these homes. However, when the 610 was built, a lot of these folks lost their homes, right? And they were scattered throughout Houston. So again, wanting to, one, be responsive, but then also acknowledge some of the historical issues and how these transportation policies have impacted these communities was really the goal in picking some of the cities as well.
And I can go ahead and just jump in with Atlanta. I mean, obviously, Atlanta was actually a transportation hub even before these highways started coming through. It was founded on the railroads coming through that area. And so it was always a major transportation hub for the South. And by the 1800s, the rail lines were going in all different directions. And so it was key. It was a key location for African Americans in the South, and a lot of industry and other types of businesses across the South have been focused and headquartered in Atlanta, and they started many, many, many centuries ago. And so Atlanta has always been a hub. It's always been a key location for African Americans, and not only the Sweet Auburn community, but there are many other communities that are in the greater Atlanta area that have been marginalized and limited over the years and over this time since we've been talking about the highways coming through. The Sweet Auburn community happens to be just right smack in the center of where these highways went through. But I definitely think Atlanta was a central and key city that we needed to study as we started this research.
And I'll chime in talking about Oakland, California. And the interesting thing about Oakland and Berkeley, 2 cities in close proximity, both in the same county. Having worked for decades in the realm of county government and understanding the enigma that counties face doing this work and saying we're not just going to focus on cities, we want to also focus on counties. Because at the end of the day, those 3,069 counties across America, 98% of the cities in America are within the boundaries of a county, which says that the city doesn't have as much autonomy to operate and function as a county does. And so it's that county seat that is the point of contact to state government, which is the path to the federal government. What do I mean by that? That policy is a driving force, and all politics are local. So when you begin to talk about engagement, you begin where the people are. There's a saying that you don't ask the doctor if the medicine is working, you ask the patient. And so a lot of this effort was looking at what happened after the Highway Act of 1956 to these communities. And in Oakland, it goes back to the BART system, the Bay Area Rapid Transit System. That was the first intrusion into the Black and Brown communities of the Oakland and Berkeley area. And you can look at maps and see the redlining. Yes, I'm saying those terms that are familiar to people without understanding what it meant in the backdrop of America. That if you had places that you really didn't care about, didn't think were going to be prosperous, the policies made at the federal level didn't look at the impact of inequities that have impacted communities of color, Black and Brown communities, since they became communities. And it's a history study, quite frankly, and looking at the overlay of where the conveniences of transportation are designed, which, oh, by the way, is more than a 20, 30-year process. So if you wait till the shovel's in the ground, you've missed the opportunity to impact policy from an equity-centered perspective, which anchors this work in policies aren't done for the sake of policy, they're done for the sake of people. And if all the people aren't included, particularly those that are most disadvantaged, then you're going to end up replicating the wishes and desires of the dominant culture. And when I say the dominant culture, that is the culture with power, with assets and resources to decide yay or nay on these transportation projects. And once it is decided to come through a local community, a Black or Brown community, you see the impact in the devastation of commerce, local commerce, of minority-owned businesses. You see it in the limited use of health, access to quality health care. You see it in public facilities, libraries, schools, healthcare, child development centers. So it impacts every aspect of life, food deserts, all of that is devastated in communities that were rich with these resources as a result of this. And so after BART came Interstate 980, which was an interstate that really has never been fully utilized. You will never find rush hour on Interstate 980 because there are a bunch of other interstates and highways that cross sector it, so that it becomes more of a luxury for those who wanted that convenience and knew how to express their voice via a system in place to move policy in their favor. What does all that boil down to? It boils down to citizens being informed at what's at stake in their local communities. And it means you get involved not when you see the first sign of construction go up, but you have to listen and have your ear inclined to those representatives that you send to represent your community, so that equity-centered policy becomes full-centered. And doing this work is creating a model that local communities can begin to put in practice, not just put it on the shelf, put in practice to organize and become the voice that they need to be in order to have better communities for sustainability and a future.
Well, Dr. Helen, you're giving us a whole lot to think about there. I love that. When the shovel's in the ground, it's too late. It's too late. So let's talk about, you visited communities in Atlanta and Houston and Oakland to gather input. Can you tell us about why that community input matters and how that community engagement can inform policy?
Thank you, Mary. I want to start. How did we decide on the county level? So I spent a quarter century of my life in county government and understanding the process and the nuances that no two counties are alike within a state. And having relationships with people in high places makes a difference. And why not start with the people that you pull levers for, that are put in position to represent you? And this has nothing to do with party affiliation. It has to do with who is your representative based on where you live in your community. Get to know who they are. If you didn't support them or didn't know who they were, go and introduce yourself to them. You want to know what initiatives are you working on that are going to benefit my community. But what you want to do is talk to your neighbors, the people you live next door to, across the street from, who you see in the local grocery store, in the health clinic down the street, in the school building where your children attend. You want to build those relationships around what's helping community to be rich and prosperous and what's tearing community down. And so in Atlanta, working with the Sweet Auburn community and hearing the stories, the oral histories of communities that have been disenfranchised and inequitably treated because they did not know how to use their voice and to organize. It's the squeaky wheel that gets the oil at the end of the day. And so we began with informed interviews of county officials, not just any county official, but Black county officials, to speak to a more macro level understanding of how transportation impacted quality of life issues that really this whole project that we've been working on was designed to address, so that we can change. If we keep doing what we've always done, we'll never get a different outcome. And so we're looking to do something that's different, that's going to empower and equip citizens at the local level, residents at the local level, to advocate with information in an informed manner to the people who have a responsibility to take their voice to the next level. What you will find is that there are very few pieces of legislation that begin in Congress that did not emanate in a local community for which everyone in America lives in. And so we found that in Oakland, hearing the stories, every community is different, but the stories that we had the privilege to hear under the same questions had a common thread that ran through them. We don't get what other communities get. And I remember when.
That's right. Thank you for that. So Tonya, you also were involved with Dr. Helen in reaching out to communities, and tell us about these strategies and how will the strategy of listening to the stories and engaging folks from the communities, how will that ensure a comprehensive community equity-centered focus, if you will?
Speak to the strategies themselves just a little bit, Mary. I mean, for me, just to be living in the Atlanta area and to have such an opportunity to delve so deeply into the Auburn Avenue history and legacy, it was really just a matter of listening, right? Listening to the voices of the community. It was so just chilling, really, to hear from people at the Apex and the Atlanta Daily World and Atlanta Life and the Royal Peacock and the Oddfellows building and the Butler Street YMCA, and the list goes on and on. And so we listened and we heard from people that were at those locations when they were in their heyday and who are still participating and doing things throughout that community. And we have a whole group of consultants that helped us with that. But even beyond that, we went out into the community with our listening sessions. So I would say listening was really just the first piece of what we did. And then we really wanted to know what works in your community. What works in one community is not going to work in another community. How does your community get together? How does your community interact? Miss Wilson Princess will let you know that they have a a very strong communication system. She can pick up the phone and call almost anybody in Auburn Avenue and get exactly the information that she needs to get because she knows who to talk to and who to go to. And so just having that listening and that respect and that thankfulness for the history that had been established in that community over time was so important. And I just listed off a few, kind of important historic locations, but just to get the everyday history lessons. And I know we're probably going to talk about that a little bit more, but to get the everyday history lessons of families, intergenerational communications, all the things that happen in the day-to-day life of citizens as they were impacted. That was really one of the biggest strategies that we had. And we honestly built on those things as we went from one community to the next community. And when we got to the next community, sometimes we had things that we would take back to another community because in the Auburn Avenue area, we have been working with those consultants for over a year. And so we could bring things back and forth and share across the communities that we met with. But really, just really starting with those listening moments, starting with gathering the information, talking to everyday citizens and getting everyday history lessons was phenomenal. I will never forget, we went to one of the senior centers and a gentleman stood up and he basically started giving us he was just there for bingo and lunch. Okay. But he started giving us the entire history of how the real estate had been manipulated and sold and just changed hand over hand in that community. And we looked at him and we were like, okay, can we talk to you some more? Because you've got a great depth of knowledge about this. But he was there because he was a young man. And, he listened to the older men when they were talking about it, about what happened and how this happened and how this changed hands and how they were working to get it back and how they were working to keep it. And all those things were really very impactful for the way that we engaged with the community.
And so, Princess, Tonya did introduce you, and I want to again welcome you to the conversation and ask that you tell us what was it like to share your story. Thank you very much for stepping forward when the team was looking for individuals, but can you speak about the experience with the team and what was your takeaway from the experience?
Yeah, well, thanks, Mary, and also thanks to everyone and all these speakers that came up and was speaking. I'm learning more and more every time I listen to you guys. But for over 60 years, I have been telling my story about how my neighborhood, I live in an inner city housing project in Atlanta, and where I went to school one day with one address and came back with another address because because of the Highway Act that was coming through in 1955, they decided to move my building where we lived in on one street up to another street up the hill. So I have been experiencing this and telling this story quite a bit to other people in the neighborhood, but never got a response. And then when I saw at one of my neighborhood meetings, our neighborhood planning unit, one Monday night, and I overheard somebody from the center was speaking. I don't remember if it was Mary or was it you, Dr. Helen? I don't remember. But someone was there speaking about what you wanted. It was just an introduction. They were talking about what they were planning on doing. And of course, that hit right on the spot with me. I said, I've been trying to tell this story forever. I've told it to different people in the city and where they put a plaque up, but that's as far as it went in the neighborhood. But it was in the Sweet Auburn neighborhood, and which is also a small portion of Old Fourth Ward. Well, it used to be Fourth Ward. Now they changed it when the real estate changed a little bit. When they try to change the name of a bad neighborhood, what they do is add something else to it to make it sound like you can sell more houses or the real estate becomes more valuable. Well, when I started telling my story, and then, well, let me go back a little bit also, because when you talked about all the health, I never understood what the health benefits, the health consequences from that move happened. But then I remember when you started talking about asthma today, my sister had asthma all her life and we never knew where she got asthma from. She was the only one in the family that had asthma. But growing up, it was quite difficult with a different address and the neighborhoods being divided. And also the businesses, because my dad had a shoe repair shop on Forest Avenue, which is now Ralph McGill. but it was in Buttermilk Bottom. And that was through urban renewal, came right after the Highway Act was coming through. So we moved around a lot, which caused him to smoke more frequently than usual. But we went through that whole process. And so this was really something I've been waiting on and wanted to get involved with, since I do know I'm a neighborhood leader. I've been involved in all different committees on different boards in the neighborhood because I want to be involved and I want to make change that's happening now, that's going on right now, and hopefully prevention. But the more I think about it, we never talk about the health, that the disparaging health that we had in our neighborhood because of it. And I think what they're trying to do is make sure Sweet Auburn comes alive again, where it can come alive again, and we have control these unhoused people that are there and all over the street. We need to do something that's going to motivate them. If they're going to build a construction or something, need to do something for that. So I'm still opening my mouth. And of course, some of the new presidents we got of some of the different organizations here now are trying to shut me up, but I told them they won't shut me up because I'm going to be there. I'm going to talk. I'm going to ask questions and make sure why some neighborhoods can get relief, especially the seniors in one neighborhood through their property taxes, where some cannot. And so I'm on a mission, and I do thank the Committee for Black Health and Equity to get me started again. And so I'm retired, and I'm looking forward to working more and more on this.
Thank you. Thank you so much. You are asking the right questions, and that is exactly what is needed based on what Dr. Helen just said, right? Ask the questions early and often. And so when we talk about lessons learned and recommendations, Nelson, can you talk about the lessons that researchers and policymakers can learn from this project and from the approach that was taken?
The lessons that can be learned. How much time do we really have? I think for me, I think the number one overarching lesson that researchers, and specifically and especially policymakers, should not only include, but is to engage the community when doing the work that they're doing. If it's researching work, if it's policymaking work, the community needs to be engaged, not just heard from, not just included, actually actively engaged if the work impacts the community. It's very simple concept. Especially when when it's the community that has to shoulder the burden of the historical harm. I think we've picked these cities, we've picked these communities that have long histories of being on the wrong side of decisions being made with respect to transportation and infrastructure. And so if there's research being done, if there's policies being implemented, more specifically, if there's money flowing, then the community's voice needs to be heard in that decision-making process. But we also want communities to feel empowered, right? To make certain that the lessons that we're trying to impart are actually learned by the policymakers that need to hear them, right? So the resource that we've mentioned, the resource that will live on for the center, it outlines a couple specific steps that communities in particular can employ. That's holding your leaders accountable, that's requiring leaders to focus on community health, that's pushing for representation and representative policymaking, then that's also just seeking out options for redress. I mean, I say those things in the vacuum, you will see them on the resource, but what does that actually look like, right? I think in the realm of holding your leaders accountable, it could be holding town halls with community members to express their concerns, or even publishing a community report card that rates local transportation offices and elected officials on their achievements and failures related to highway projects. When we talk about meaningful representation, that might look like government issued microgrants that allow communities to actually build coalitions, get together and formulate those communities that already exist, but speak with one collective voice. Or it could be designating a certain number of transportation board positions for representation from the community. Or even when we talk about redress, which is a very kind of a legalese word, it's a $10 word, right? That could be something as simple as establishing a process that allows a community to appeal or even, hopefully reverse a project if there's significant opposition. The sky really is the limit on how all of this can look, but it starts with making sure that the community is heard. And I think that's the most important lesson that could be taken from this work. The point is that the work that we're all engaged in is supposed to be a microphone, it's supposed to amplify the voices that are already there. I'm not saying that the community needs to speak up, because the community is speaking up. It's just a matter of us listening actively for what is trying to be said and what's trying to be heard. So that's the main lesson. Just stop, look, and listen to what the community is already experiencing, and make sure that their voices are heard in the process of making decisions.
I love that. Stop, look, and listen, right? Stop, look, and listen often. Manire, is there anything that you can add to really helping us to understand why centering equity and community is important for the betterment of the Black community today? I mean, Princess talked about what's happening today in Sweet Auburn. Why is centering equity important today?
Sure, thanks, Mary. So I hope my other panelists don't mind this, but in the words of Iyanla Vincent, we have to call a thing, right? And the one thing that I think we haven't chatted about yet is a lot of these policies, as well as the destruction of our communities, was really fueled by racism, right? A lot of it was fueled by racism. People not really valuing Black lives, right? If we think about the time, this is the late 1950s, early 60s. And as a legal person, I understand that this is a pivotal moment for our country, because a lot of the landmark cases are all coming out, right? The education cases, the racial zoning cases, and the court is simultaneously striking down racist practices and policies that impacted Black communities, right? And folks are mad. Folks were pretty angry. In fact, Robert Moses, who's an urban planner in New York, he specifically said the way to get rid of the slums is by building highways that go directly through them, right? And these slums that he's referring to is the Bronx, is Brooklyn, right? Highly populated areas of Black folks who were doing their thing and had thriving and bustling communities, right? And that was his solution. Let's destroy them by building a highway. And his sentiments really rang true throughout the country. So when we talk about equity and being community-centered, it's time for us to address and to reconcile the historic and present-day injustices that Black communities are forced to endure through law and policy. The only way that we're able to meaningfully do this is by going into community. And when I say going into community, I want to be very clear. I'm not saying going into community as a bystander, but going into community as a vessel to effectuate change, right? But unfortunately, as Nelson mentioned, as Dr. Helen mentioned, they're not being listened to. They're not being listened to, and their voices are not being elevated in a place where they're actually able to see the things that they hope to see with their communities. I think that when we talk about policies generally, right, if we look at a lot of the policies that we looked at on their face, there's really nothing specifically that calls out the injustices that happen, that calls out the inequities that happen. And a lot of times you'll hear lawyers and other people in the legal realm say, no, policies have to be, not necessarily focusing on what has happened. They have to be vague, things like that. But really, it's time out for that, right? Because we know these policies have only served a certain demographic of people. So therefore, our solutions have to be aimed at equity. They have to be aimed at understanding these are some of the communities that are marginalized. And that is the starting point, right? That's not the finish line. We start with community, but we finish with creating something that is codified so that generations no longer have to deal with this, right? We need to solve these issues now so that our grandchildren and their children will be able to enjoy the effects of great policymaking that's community-centered and equity-based.
Change is not instant. It is the thing we hate the most to embrace. Change, but everything's just fine. Is it really? Take a look and don't stop being a bystander. You got to get in the game and be an upstander, to take the high road, to speak your piece, not with animosity or anger, but to speak it with the truth of how it has impacted you, your family, and your community. And you will find allies and alliances that say, yes, I want to get on and be a part of what's happening. And I ask community people to be patient and don't give up. Be like the little train that said, I think I can, I think I can, I think I can, and it did.
For these reasons and others, why I am so excited to have been involved in this important project, and why I'm confident that the roadmap that was created because of this project will enable health equity leaders and scholars, all of us, to actualize and operationalize health equity in our communities across the United States for generations to come.
What's the one takeaway you hope viewers will remember? Dr. Helen, you said change is not instant. It begins in the neighborhood in terms of the policy recommendations and talking to people about what's affecting them, and then speaking your truth. And in doing so, whether you're talking to your neighbors or at the neighborhood meeting, you'll begin to find allies. Are there other takeaways, the one takeaways that you would like to leave this conversation with? And I would just open the floor for anyone who would like to speak right now.
Yeah, so I'll just say it, racism truly is the thread that holds the tapestry that is America together. And it's time for us to get our scissors, right? We got to cut this thread. And the way that we cut this thread is by having community-centered and equitable policies, right? And that's at every level. The conversation today is about transportation, but this conversation can be plopped into healthcare. This conversation can be plopped into education. This conversation really, it's multi-layered, right? And we cannot be afraid, as Dr. Helen mentioned, to go into community, right? And to start with the community so that we're able to solve some of these issues. But because I was raised Baptist and I like a good tagline, get your scissors ready because it's time to start cutting.
Get your scissors ready. Nelson, is there anything to add?
There's nothing to add, but I will also say I was also raised Baptist, so I have a praying grandmother and a praying mother and praying parents. And for me, what I took out of this, and out of this conversation, and out of my life, is that the work we're doing now, we may not see a response or an answer to it tomorrow. But the thing that you have to keep in mind is sometimes you are planting seeds for trees that will provide shade that you will never see. So the work that you're doing now, and the work that you're going to continue to fight for and advocate for now, will be just like Manire said, for the next generation. Don't give up hope. Sometime we're going to need that, and it'll keep us cool. So thanks.